This is Jay and Amber from Precision Assess.
Welcome to the deep dive.
Today, we're taking a deep dive into something really important, but maybe not talked about enough: the health and well-being of caregivers.
Right. We mean family members, friends, neighbors, and professional caregivers too, of course.
We've got a stack of information here, articles, research notes, all focused on this.
Yeah, a lot to go through.
And our mission really is to unpack what these sources tell us about the challenges caregivers are up against.
And more importantly, what can actually be done? Ways to help them stay healthy and keep doing the vital work they do.
You might find some of this surprising, actually, the risks involved.
But there's good news too. The sources point to some really practical, helpful things you can do or maybe help someone else do.
Okay, let's get into it. So just how many people are we talking about here? Is this a common thing?
Oh, it's huge. The research suggests around 44 million adults in the U.S. alone.
44 million, wow.
Yeah, people 18 and older providing unpaid care and support, usually for older relatives or adults with disabilities. It's a massive number of people doing this, often quietly.
That number's staggering. And the sources even tried to put a dollar value on that unpaid help,
They
right?
did, somewhere around $306 billion a year, minimum.
Which is what? Almost double the cost of formal home care and nursing homes combined.
Exactly. It just shows how much essential support happens outside the official system, often, just out of love or, because there's no other choice.
But what's worrying, according to these sources, is that even though so many people are doing it,
Many aren't really prepared for it, and they get very little support themselves.
yeah, and this statistic really stood out. Over a third of caregivers keep providing intense care, even when their own health isn't great.
Which leads right into the core issue, that poor health isn't just, feeling a bit run down.
No, the sources are really clear. Caregiving puts people at serious risk. We're talking emotional, mental, and physical health problems.
Right. It often stems from dealing with really complicated situations, the sheer strain of it all, especially with people living longer but maybe coming home from the hospital quicker.
So more care happens at home for longer.
Exactly. And that takes a toll. Should we start with the mental and emotional side?
Yeah, let's do that. What do the studies show there?
Well, pretty consistently, research shows caregivers experience higher levels of sadness, depression, anxiety, just generally more mental health struggles compared to people who aren't caregivers.
Okay, so how common? Like, what are the numbers on depression, for example?
The data is pretty significant. Estimates suggest somewhere between 40 and 70% of caregivers show clinical symptoms of depression.
40 to 70%.
Yeah. And digging deeper, maybe a quarter to even half of those actually meet the criteria for major depression.
Wow.
The risk seems especially high for those caring for someone with memory loss, like dementia. There's like 30 to 40% struggling with depression and just high emotional stress.
That's a huge burden. And the sources mention that this doesn't just disappear if the person eventually goes into a care facility.
That's a really important point. No, that sadness or worry can unfortunately linger.
And it's not just about clinical depression, is it? The sources talk about other feelings too.
Definitely. High levels of stress, frustration. Caregivers report feeling angry, drained, guilty, helpless. One study mentioned 16% feeling emotionally strained.
And over a quarter finding the emotional side of it just really hard.
Yeah, and things like feeling a loss of identity, lower self-worth, constant worry, those come up too.
Nearly a quarter said they feel exhausted even before bed and just can't manage everything.
And there's even research suggesting this kind of chronic, intense stress can affect thinking. Things like short-term memory problems or difficulty paying attention. The brain is just overloaded.
Okay, so that's the mental side, but then the research pivots to the physical health impact, and that seems just as concerning.
It really is. Broadly, the sources state caregivers just report being in worse health overall compared to non-caregivers.
How much worse?
Well, about 1 in 10 caregivers explicitly say caregiving has made their own physical health worse.
Okay.
And if you compare them, nearly 3/5 of caregivers reported fair or poor health or a long-term health issue. That's compared to only about a third of non-caregivers.
So almost double the rate reporting Ming. Fair or poor health.
Pretty much. And they reported chronic conditions, things like heart disease, cancer, diabetes, arthritis, at almost twice the rate as well.
Twice the rate for serious conditions. That is alarming. And it's not just about major illnesses, right? The physical stress shows up in other ways.
Yeah, more physical complaints like headaches, general aches and pains. The research suggests a higher chance of developing serious illnesses over time because of the chronic stress.
And the body's defenses, how does that play in?
That's fascinating and also worrying. Studies show caregivers often have a weakened immune system.
Meaning they get sick more easily.
Exactly. They tend to have higher levels of stress hormones, cortisol, things like that, and lower levels of the cells that fight off illness. The sources even mentioned wound healing can be slower.
Wow. The body's clearly reacting very strongly to that ongoing stress. And there was a big connection to heart health in the sources too, wasn't there?
Absolutely.
Yeah.
A greater risk for heart problems, high blood pressure, actual heart disease.
There was that one specific finding.
Right, about women caring for an ill spouse. If they were doing it for 9 or more hours a week, their risk of heart disease actually doubled.
Doubled. Just from that specific situation, that really hits home. And part of this, the sources suggest, is because caregivers often neglect their own health.
That's a key piece. The research shows they're less likely to do things to stay healthy.
Like what?
Skipping their own doctor checkups, maybe not filling prescriptions because of cost, often having worse eating habits, not exercising. One source noted nearly 3/4 of caregivers said they hadn't gone to the doctor as often as they should have.
It sounds like this really difficult cycle. The caregiving causes stress, makes them feel unwell,
Which makes it harder to find the time or energy to take care of themselves.
which then leads to them becoming even more unwell.
And sadly, the sources talk about the ultimate consequence, a higher risk of death.
Yeah.
There was research finding that elderly spouse caregivers who were experiencing significant stress had a 63% higher mortality rate than non-caregivers their age.
63% higher. That statistic is just incredibly stark. It shows the ultimate price that can be paid sometimes.
It really does.
And when caregivers are struggling this much, it's not just about them, is it? It impacts the person they're caring for.
Absolutely.
Yeah.
Directly. When someone's burnt out, the sources say it can lead to mistakes, maybe with medications,
Right.
or missing important health signs in the person they care for, missing appointments. And the emotional strain can damage the relationship, the trust.
And in the worst cases.
In very stressful situations, the sources even mention a greater risk of harmful behavior towards the person receiving care. Neglect or worse.
So looking after the caregiver isn't just a nice thing to do, it's actually essential for the quality and safety of the care itself.
Exactly. It's fundamental.
Okay, so that paints a pretty tough picture. But you said the sources also offered hope, solutions.
Yes, definitely. The good news is the research doesn't just stop at the problems. It points to clear ways to, improve things and support caregivers.
Okay, so what does the research say actually works? What are the actionable things?
Well, several things came up again and again in the sources. First, getting a proper assessment of the caregiver's needs, not just the person needing care.
Focusing on the caregiver too.
Yes, and that assessment should then feed into a care plan that includes specific support services for the caregiver.
That assessment sounds like step one, understanding the whole picture, what everyone involved really needs.
It is. And closely linked to that are things like caregiver education and support programs.
Learning coping skills, getting information.
Exactly. Learning how to manage, getting good info about the condition they're dealing with, and crucially, connecting with other people who really get it. Peer support. These things make a huge difference in how caregivers cope.
Makes sense. The sources also mention respite care quite a bit. Can you explain that simply?
Sure. Respite care is basically giving the main caregiver a planned break.
A timeout?
Yeah. Could be just a few hours, maybe a whole day, sometimes longer. It lets them rest, recharge, run errands, just take care of themselves. The sources stress how vital this is for reducing stress and preventing total burnout.
Okay. What else? Financial support came up?
Yes. Caregiving can be expensive, lost wages, direct costs. Money worries just add another layer of stress, so financial help can ease that burden.
Right.
And finally, the role of primary care doctors was highlighted.
Their family doctor.
Yeah. The research suggests doctors should be actively looking out for the caregiver's well-being too, even if the appointment isn't technically for them.
Asking how the caregiver is doing.
Exactly. Looking for signs of stress, pointing them towards helpful community resources.
Okay, so to recap, assessing caregiver needs, support programs, respite breaks, maybe financial help, and doctors being more aware. These are key pathways.
Those are the main ones highlighted.
And this is where services that help structure things, like the ones some sources mention, can really fit in.
Right. Think about getting a comprehensive assessment done, one that looks at the whole situation. The person needing care, yes, but also their home and the person providing the care.
Understanding the full context.
and then using that to create a care plan that considers the caregiver's capacity, their own needs, alongside the recipient's needs.
And practical support like nurse delegation, that was mentioned too. How does that help?
Well, nurse delegation is where a qualified nurse can oversee certain medical tasks and then train and supervise an assistant, maybe even a family caregiver sometimes, to perform them safely.
So it takes some of the direct medical task pressure off the main caregiver.
Exactly. It can lower their stress, reduce worry, and potentially reduce risks for everyone. It's about building that support network
Recognizing how vital the caregiver is and the load they carry.
and making it safer and more sustainable for the long haul.
The sources also had some really practical, everyday tips, things caregivers can do themselves or that we can do to support a caregiver we know. It starts with just recognizing the warning signs of stress, right?
Yes, absolutely. The article suggested watching out for feeling totally drained, uh, getting easily irritated, being forgetful, feeling lonely or isolated,
Trouble sleeping.
trouble sleeping, feeling persistently sad, losing interest in things you used to enjoy. Those are big ones.
And physical signs, too.
Yeah, frequent headaches, unexplained pains, maybe changes in eating or exercise habits, or maybe relying more on alcohol or other substances. Those are all red flags that the stress might be getting overwhelming.
And the advice is, don't wait until you're completely overwhelmed. Learn your personal warning signs.
Exactly. And then the next step, which can be really hard, is finding a way to ask for help.
Yeah, the research acknowledges that's tough for a lot of caregivers.
It is. But the sources pointed out that often people want to help. They just don't know how or what's needed.
So the tips were things like start small, ask for specific tasks.
Yes, be specific. Maybe ask via text or email if talking about it feels too difficult. Think about what the person you're asking is good at or enjoys doing.
Have a list ready.
Have a simple list of things someone could do. And importantly, practice saying yes when help is offered. Accepting help is a skill too.
Practice saying, thank you, that would be wonderful. Actually, you could.
Exactly. And it's okay if someone says no, but don't stop asking. And family and friends aren't the only source of help.
Right. Where else did the sources point?
Talk to your doctor, and they might have advice or know local programs. Consider talking to a counselor or therapist if you're feeling really down or anxious.
Local agencies.
Yes, local senior centers, social services departments, area agencies on aging. These are often great hubs for finding resources in your community. Even faith communities sometimes have specific support groups.
And for self-care, the message was that even small things count.
Definitely. Try to stay physically active, even short walks. Eat nourishing food when you can. Prioritize sleep, though that can be hard,
Find simple ways to de-stress.
like deep breathing, listening to music, maybe using a relaxation app. Making even a little time for things you enjoy, things totally separate from caregiving.
Keeping up with your own doctor's appointments.
Crucial. Reaching out to talk to someone you trust. And, back to that earlier point, taking breaks when you need them. Whatever that looks like, asking family, hiring help, maybe adult daycare.
And the sources reminded caregivers to be kind to themselves.
Yes, be gentle with yourself. It's okay to feel frustrated or sad sometimes. Acknowledge the incredibly hard work you're doing.
And for those of us who aren't the main caregiver, there were tips too. How can we help?
Start by just acknowledging them. Tell them you see how hard they're working. Offer emotional support. Just listen without judging.
Offer practical help.
Yes, take on specific tasks. Offer to help manage meds, do grocery runs, help with chores. Offer to stay with the person needing care so the caregiver can get a real break. Maybe even a short trip.
Even just staying in touch matters.
A quick call, a text, it can mean a lot.
Okay, so wrapping up. We've seen just how much strain caregiving can put on a person's health, mentally and physically. It's significant.
But the sources are also really clear. Support and taking action can make a huge difference. Things can get better.
And looking after the caregiver, as we said, isn't just about them. The research shows it's absolutely critical for the well-being and safety of the person they're caring for, too.
Right. And the sources pointed to concrete things that help. Getting needs properly assessed, finding support programs, taking breaks, getting help from healthcare professionals.
And this connects back to the kind of support we focus on at Precision Assess, helping with those assessments, creating care plans that include everyone, providing support like nurse delegation. It's all aimed at achieving better health outcomes.
For both the person receiving care and the dedicated people caring for them.
So here's a final thought, something to mull over based on what we've discussed. Think about that hidden cost of caregiving we talked about. Not just the huge economic value, but the cost to a person's health, even their longevity.
What does that really mean for how we, as a society, as communities, should be stepping up to support caregivers?
If you or someone you know is involved in caregiving and you're looking for ways to improve that support system and the outcomes, please reach out to Precision Assess.
We're here to help navigate these challenges.